Right, we are and live. So, before we get started, I do want to do a quick Zoom tutorial and overview for you all. I know that we're probably all used to, using Zoom at this point, but still, it doesn't hurt to do it. And I do want to mention that we do have interpretation available for both Spanish and ASL. All you have to do is click on that channel if you need that interpretation. So once again, interpretation is available for you today. Make sure you click the world button and you should be able to hear or see the interpretation that you need today. Another important point too is that you can change if you want to see who is here today into gallery view. So that way you're not just staring at the speakers, right? And you can see who is here and is interested in also learning about behavioral health, specifically Measure 110 and HB 4002. For agenda for today, we're going to talk a little bit, not too much, about who is OHEA. Then we're going to have our friends from HARA do a presentation on this topic. And at the end, you will have the opportunity to do questions and hopefully we can get some answers. And if we can't, that's all right because we can connect with each other and make sure you get those answers. So feel free to put your questions as they are presenting in the chat and we will make sure that those get answered. Hopefully we don't run out of time as well, but please use the chat for that too. Before we get started though, I do want to read a land acknowledgement that was adopted by from Forward Together, and that reads as follows. Every community owes its existence and strength to generations of ancestors who contributed to our hopes, dreams, and collective possibilities. Together, their history allows us to leave our own legacy of hope and justice. Our collective history is that of cultural resilience, reingeneration, adaptability, colonization, settlement, systemic violence, racism, and forced displacement. Acknowledging this truth helps us build mutual respect and connection across diverse communities and lived experiences. The land on which OHEA is situated serves and which we occupy tonight, that we know as the Portland metro area, rests on the traditional village sites of the Monoma, Wasco, Cowlitz, Cathlamet, Clackamas, Bands of Chinook, Tualatin, Kalapuya, Molala, and many other tribes who made their homes along the Columbia River, creating communities and summer encampments to harvest and use the plentiful natural resources of the area. We're on this land because of the forced removal of its traditional peoples by colonists and settlers. We recognize that the right of Native and Indigenous people and nations have been and continue to denied and violated. We want to thank the original caretakers of this land and their descendants who are still here. In addition to our thanks, we encourage folks to take action in supporting Native and Indigenous communities, such as learning more about the Indigenous people of the land they occupy, honoring treaty right obligations, creating deeper relationships, and supporting land back initiatives by and for Native Indigenous communities. And we also have a quick labor acknowledgement, sorry. We acknowledge that much of the work we know of this country today includes its culture, economic growth, and development through history and across time, has been made possible by the forced labor of enslaved Africans and their descendants who suffered the horror of transatlantic trafficking of their people, chattel slavery, Jim Crow, and repressive laws, including the Black exclusion laws in Oregon, that continue to impact Black folks today. We are in debt to their labor and their sacrifice. Moreover, we must acknowledge and address the tremors and legacy of the violence through the generations and the resulting impact that can still be felt and witnessed today in our region and beyond. And I do want to acknowledge that these two acknowledgments were adapted Fight Forward Together. But who is OHEA? I know that some of you all are returning, some of you all are members of OHEA, so this must be something that you have already heard, but for those who are new to OHEA, OHEA is a color-led collaborative organization who centers and uplifts the wisdom of our communities of color through racial justice, informed health equity policies, and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. We envision a world where people of color are able to live fulfilling and healthy lives however they choose. Now, we do have three bodies of work, which are advocacy, convener, and knowledge center. But for the next 3 years, one of our main focuses is behavioral health. And this is the first part of that series that we will be inviting you to continue in the next year as well. And hopefully you can join us. I do want to give you all a couple quick reminders before we get started. Please make sure your name matches the name in the registration. When you register via Zoom, those who are attending will be receiving a meal stipend later this week. So we want to make sure that we're sending it to the correct people. And if for some reason your organization or your agency does not allow you to receive gifts, we highly encourage you to pay that forward and donate it to somebody else. Or if you have trouble finding somebody, you can reach out to us as well. Please, as I said earlier, use the chat box to ask questions. We will ask them towards the end, and the session is being recorded. And another thing, please take care of yourselves. So without further ado, I want to welcome the Health Justice Recovery Alliance. And the Health Justice Recovery Alliance is a statewide advocacy organization that represents nearly 100 community-based organizations and addiction recovery services provider across the state. So yeah, you heard that right. Nearly 100 community-based organizations. They work to improve Measure 110 implementation policies, which is what we're going to be talking about today, and practices to ensure that the law's funding focuses on healing and restoring the communities most harmed by racist drug war policies. And those communities include Black, Indigenous, Latino, Tribal, Native, and other communities of color. But I will hand the mic over to both Devin and Tara to take us through their presentation. Welcome, you two.
Thank you, Daisy. Hi, everyone. Okay, I am going to attempt to share my screen. So my name is Tara Hurst. I use she, her pronouns, and I'm the executive director for the Health Justice Recovery Alliance, and I'm excited to be here with Devin Downey-Smith, who will introduce herself when she does her part of the presentation. It's nice to have some time to really talk about Measure 110 and what's happening now, and kind of why, a little bit of background of how it came about and why it's important. So thank you, Daisy, for always, and OHEA for always kind of creating space for learning and convening all of us together, and for giving our intro. So now you know what HJRA does. We came about as part of the Yes on 110 campaign. Once the measure passed, there was an understanding and recognition that we really need to make sure to implement it. I was not a part of the campaign, Devin was. I was asked to come along to lead the implementation effort. So we all know that really great policy can pass, but if there's nobody pushing on the system to make sure that it's passed as the voters are intended, most likely won't happen. So for us, you know, we talked to all of the organizations who had supported the campaign and then brought a lot of new organizations in once it passed. And these were predominantly addiction recovery service providers, harm reduction service providers, and a lot of small community-based organizations who have not been engaged in this system, in the legislative system and in policy making, but are really the ones on the front lines who are the ones healing our communities and knew and know best what they need from kind of a systemic support system in order to be able to support the people that we all love and care about. A lot of the folks that we work with are linguistically specific and culturally specific providers. That is some of the care that is so, that OHEA also works to make sure we're expanding that care. So the two main North Stars that we really bring to any policy work that we're doing during implementation was moving from a criminal justice response to addiction to a healthcare-based response to addiction. We went to Portugal last year on a learning trip, since they've been doing this for 20 years. And one of the architects of their policy simply put it as, do we want to treat somebody as a criminal or as a patient? And that was something that really struck me. And I continue to try and make sure that we're putting that forward when we're talking to people. Are we talking to somebody who's a patient and needs health services, or are we talking about somebody who needs to be punished and stigmatized? So that is one part of our work, is really around, let's make sure we're moving towards a healthcare response. And the other was really, we know that the drug war was born out of racist policies. It was to make sure that we were, continuing slavery in a different way of mass incarceration. And how do we support and invest in the communities that have been most harmed by those practices? So in Oregon, that is the Black, Latino, tribal, Native, and Indigenous communities who'd been harmed most. And so we really have been working closely with those communities to make sure that funding and policies are being put in place, and we're supporting and lifting up those voices as we work on any policy changes. And this just kind of shows that by advocating for the resources to address these inequities, and we'll go through a lot of this over the next, hour with you, is really, what are the changes that have been made? And you'll see, and Devin will tell you a lot of what she's heard across the state as she talks with folks and goes and visits. The Measure 110 services and the investments that have been made have had an immeasurable impact here in our state. We still have a lot of work to do, but it's pretty exciting. And they're becoming more and more visible. So you can see here sort of, building the Measure 110 house, which actually has been done in multiple counties. And then last year, and we'll talk a little bit about it later, we got together with law enforcement and another peer support provider to figure out how we could help people who are really struggling on the street, connect them directly to care. If law enforcement is going to be involved, how do we get them out of the equation as fast as possible? And so we created this peer police project, which really was when a police officer would call saying, I have somebody here who's asking for help, we would have an outreach worker go and meet with them within 10 minutes, and the police officer would walk away. So not the system ultimately that we want to be building, but definitely in a space where we do rely heavily on law enforcement for our social services in this state. This was a great great success, which we'll show you a little bit later. So what did Measure 110 do? You've heard about it in the media, you've heard about it probably in multiple different places. Let's just get you steeped in what it actually did. So it invested hundreds of millions of dollars into recovery and harm reduction services. This comes from our cannabis revenue. So the cannabis tax revenue goes $90 million goes into one account, and anything above that goes into the drug treatment and recovery fund. It treats people with substance use as the healthcare lens, so it reduced criminal penalties from a misdemeanor, which was up to a year in jail, to a Class E violation, which is very similar to a traffic ticket. And another thing that a lot of people don't know about is it established this Oversight and Accountability Council. It's the first that we know of its kind in charge of this amount of money to be given out to different providers across the state. And it's really I'm going to let this person in. It is a council that is made up of predominantly people with lived experience or living experience. And especially in this space, when you have the Criminal Justice Commission that is supposed, or the Alcohol and Drug Policy Commission, all of those places are very law enforcement and court system heavy. The Oversight and Accountability Council is all people who are part of the addictions field in one way or another. You've got harm reductionists there. We have people who use drugs who are on that council. People who've been most impacted by the war on drugs. So it's a really robust community council that has already distributed over $400 million into services. And these are the folks who are in the front lines, who know exactly what people need and how they actually access it. And it's not just people who have an idea of what's needed and how to access it. These are the folks who are actually doing the services. So it's a really powerful group of people. Oh, now it won't. Okay, there we go. So what did it decriminalize? It decriminalized the possession of drugs, which I said. And if you look at Class C violation, it was a very small amount of drugs, which may not feel like it the way that the media has portrayed it. And everybody has demonized kind of what Measure 110 did. We were talking about a gram of heroin, which is a very small amount. And that just meant that if you had that in your pocket, you could no longer go to jail for it. We know that criminalization is extremely harmful. 375,000 people are incarcerated for drug offenses on any given day. That's nationally. And we also know that possession is one of the top reasons for deportation. So it's not just that people could go to jail and spend a lot of time on jail. Just having this on your record could be the excuse for somebody to be able to come in and put you in through deportation process. And right now that makes that even more scary. It's also not an effective way to treat the issue, right? If this was an effective way, maybe we'd all have a little bit of, we'd give it a little more grace, although I'm not sure. If you look at the 50 years that we've had these drug war policies in effect, our drug supply is the most toxic it's ever been. We have more people incarcerated. And we've, over the last 4 years, we have had over 100,000 people each year in the United States die of overdoses. When people go into prison and they come out in the first 2 weeks, they're 13 times more likely to die from an overdose than kind of somebody out on the streets currently using. This can come up for different factors. Some is because they come back with a lower tolerance, but they don't recognize that. And so they just start using at the level that they started or they ended before they went into prison. There's a lot of other reasons for this, but ultimately, if prison was a good solution for drug addiction or for substance use, then we wouldn't be seeing these kinds of results. And criminal records create really big barriers for people, even a misdemeanor. Again, going back to deportation or getting a job, accessing housing. I'm a person who is in long-term recovery, which means that I haven't used any substances since September 8th, 1996. And I say that more because I watched a lot of people as I was getting sober, who couldn't get a job because of their criminal record, who kept losing out on apartments because of their criminal record. And this makes it so much harder when you're already in such a fragile space of the world feels like it's completely against you. You've lost your ability to the one way you knew how to cope, which is through drugs and alcohol, that's no longer an option for you. And all of a sudden you also can't get your life back on track or get your life on track because everybody is denying you jobs and housing. It also happens with students for if you want to apply for student loans. So it just creates so many barriers. So when people again say, well, it's not like we jail that many people for just drug possession alone. A misdemeanor charge is extremely harmful, period. And then I think it's important to just kind of base in fact that decriminalization did not cause an increase in homelessness, overdose deaths, or increase crime. So there was a lot of conversation that everything that was happening in Oregon was because of Measure 110. There's been plenty of studies now that have debunked this. We also have to recognize that when we passed Measure 110, Oregon was ranked as having the second highest rate of addiction rates. We also had the last in access to care, so harm reduction and addiction care. And then, with COVID, everything was exacerbated, including the fact that we lost 150 treatment beds. And fentanyl came and hit our state at a time when we weren't ready. So the new Brown University study shows that Measure 110 had nothing to do with the increase in overdose deaths. Unfortunately, it was a toxic drug supply that started coming over to the West Coast. It had already hit the East Coast much earlier, and they had kind of figured out how to address it and mitigate the harms. We did not learn from them. We were on early calls with the governor and the governor's office saying that we didn't have the tools that we needed to be able to kind of support and help people through this. We didn't have Narcan. We didn't have the just kind of basics that you need when a epidemic is coming to your doorstep. So it was not decriminalization that caused that. Unfortunately, it was fentanyl, and we're still grappling with it today. This shows an early study on what was the arrest record? What did it look like post Measure 110? And if you see kind of the pre-pandemic, 2017 to 2020, January 2020, the arrests monthly kind of hovered between 1,000 to 1,500. During the pandemic, we all know that, before the policy even went into effect, but law enforcement was not putting people in jail as much, and they weren't doing arrests except for things that maybe rose to a much higher level of concern. And then you see in January 2021 and starting to taper off in 2022 that arrests went down to about 250 folks a month. So that's, a significant difference in people's lives when you think about the barriers that we were just talking about, how those impact people, how those impact people just getting themselves together and getting themselves on a path to recovery, whatever that looks like for them. When you have less of those barriers and you're not having to just treat the legal issues when you first get into treatment, that can be a game changer for folks. So moving on to the 110 cannabis revenue. So basically, Devin created this really fun graphic. So the first bucket is the 90 million that goes in. That's all of our cannabis tax revenue goes into that bucket. And you see how 40% goes to the state school fund, 25% to OHA, 15% to the state police, and then the cities and counties each get 10%. After the $90 million, so once that bucket fills up to 90 million, anything over and above goes into this drug treatment and recovery fund. And the first year that was about or the first biennium, these are for bienniums, so 2 years. The first biennium that Measure 110 happened, so 2021 to 2023, there was $260 million in the Drug Treatment and Recovery Fund. And what does that mean? So what that fund funds, and the Oversight and Accountability Council, the one that I talked about earlier, of the folks with lived and living experience, they're the ones who are actually making these decisions. But these are the things that they fund. It funds harm reduction, overdose prevention. So that can be supplies, outreach. It's really about, if you ever have an opportunity to work with, go shadow a harm reductionist. I've never met any group of professionals who work from their heart in the most non-judgmental, most loving, beautiful way I've ever seen in my life. And I think that we'd all be better just knowing those people, supporting those people, and just seeing the work that they do. It's really beautiful. And they go into some of the roughest places that most of us just don't even pass through those kind of barriers. They go deep into encampments. They build relationships. It's based on love and trust and respect, and really letting somebody know that they deserve to be healthy and to have access to things that will help them have health. It's also addiction recovery maintenance support. So that's peer support, it's housing, it's supportive employment. Devin's going to give you a much better understanding of kind of what these things mean. I think we say these words a lot, but it's really hard unless you've needed to utilize these services, or if you've had friends and family that have utilized them. It's kind of hard to wrap your brain around. Intervention, so doing screening and assessments. Detox is becoming so much more important with fentanyl, and just the recognition that we really do need to meet folks where they're at when they're trying to go through withdrawals, which are happening within 30 minutes to an hour instead of 6 to 8 hours, which is what we were finding with heroin. And figuring out treatment planning. So that can be working with somebody to just say, what are your life goals? How do we help you reach those? What are the barriers that are in those, what are the barriers making it so it's hard for you to reach those goals? And then low barrier treatment. One of the things that Measure 110 has done is said, we don't want money to cost to ever be a barrier for somebody to be able to get access to care. So if for some reason they're not covered by Medicaid, then we're just going to pay for it. We don't want housing. So a lot of times they'll say, oh, you can have 3 months of housing and then you're out. We want to make sure that when somebody's in a unstable place and is getting stabilized in housing, if they need 6 months, then they need to get 6 months. And let's not kind of nickel and dime people and try and put everybody into the same treatment plan. Everybody needs something different. Whoops. And there we go. So this is what it looks like. At least, what was this? Last summer, we created this map. And by we, I mean somebody much smarter than me put all these things together. But this was all of the different services that were paid for through Measure 110. And so you can see it really does reach far and wide across the state. We also, the Oversight and Accountability Council, set aside tribal funding for the 9 federally recognized tribes. And so that funding went directly to the tribes for the tribes to determine what they needed to do, what they wanted to do with those funds to support their community. But this also goes again through kind of the different buckets of data or of services. And so here's some of the stuff, some of the numbers. This was at an advocacy day last year, and there's Representative Graber with our friends from the Miracles Club. So in 21 to 2025, there was 302, well, that's not, okay, there was $302 million in 21 through 2023. Then there was an additional $40 million in savings from law enforcement. So another thing that the measure did that has now been undone was that it said for the money that we save through law enforcement, we're going to put that into services as well. So $40 million went into services. 200 more million dollars went in the 23-25 biennium. And now the 25 to 2029 biennium, the request for grant applications just closed, and there is another $488 million that will be awarded out for 4 years. Now, that's a lot of money, and that is something that we can all be really proud of. It's also, there were requests of over 800 million, so it's still not even coming close to meeting the needs of what our organizations who are out there doing the hard work every day need. And then here's the latest data from the quarter up to June 30th. So this past summer that we saw a 20% increase of from Q7 to Q8. I'll show it to you in a graph. It'll be much easier to understand. But basically, you're looking at 299,000 people have been served through Measure 110 services. That's how many clients have been contacted in the past. This was 8 quarters, so in the past 2 years, which is pretty phenomenal. And I don't know that any of you got to see any of that in the media. Here's what it looks like in just kind of in a chart showing you what each of the different services, housing, assessments, treatment, screening, and peer support and harm reduction, what it looked like starting Q1 was July 2022. And now we are looking at Q7 actually ended in spring of 2023. I'm going to kick it over to Devin. Do you want me to just advance the slides, Devin?
Sure, I think that's easiest. Yeah. Well, hi everyone. My name is Devin Downey Smith. My pronouns are she, her, and I'm the communications director for HJRA. So I've had the really exciting job, among other things, over the last several years of getting to visit with a lot of these amazing providers across the state and seeing the work that they're doing. And trying to get the media to cover it. They have covered some, but as I'm sure you've experienced as the viewer, listener, receiver of how the media is, there's that saying, if it bleeds, it leads. And so there has really been an intentional wanting to find, the dark side of the policy, whether it's real or not, perceived, is kind of what has been covered, particularly on TV. But the reality is that Measure 110 services are building out an entire system of care for everyone, a system of care that's low barrier, where you're not met with as many wait lists or, told that you can't receive care because you don't have the right kind of insurance or, immigration status, or just all of the variety of barriers that people are met with that it's a broken healthcare system in so many ways. And so even when you have the insurance and you have the resources, it can be really hard to access this care, especially in Oregon. So Measure 110 is building that out. And this is just a screenshot from the first Measure 110 funded detox center that opened in Portland with this funding. And just to kind of give some context around how great the need is for these services, this facility increased Portland's detox capacity by something like 18%, a large amount, and I think it's about a dozen beds. So that just shows how great the need is for these services. And this is an amazing thing to offer. In the past, medical detox has kind of been considered something that is really great if you can access it. It makes your recovery journey a lot easier. What we're hearing now is that in the age of fentanyl, it's really considered a best practice. And it's needed in order to successfully withdraw from this drug that I'm sure we've all heard is 50 to 100 times stronger than heroin. And what we've encountered with the people that we've seen and the clients that these folks have served is that so much of what fuels the continued use is, the media will say, like, it's a party, people love getting high, but by the time you're on fentanyl, the party is over and you're really just trying to not be sick, not feel sick. And it can be as little as an hour and a half before those withdrawal symptoms start to set in, and they're extremely severe. So having these detox services available makes all the difference. So this is one. Can advance to the next one, Tara. And one of the things that Measure 110 does, as Tara says, is it funds care across the continuum of care. So that's everything from harm reduction to permanent recovery housing, and then everything that someone might need in between. So just to highlight one of the great providers, CORE, which is located in Lane County and does work in Eugene and the Lane County area. So they are a low barrier harm reduction organization that helps youth under the ages of 29 with everything from survival supplies. So whether you need a warm coat or you need a warm meal, or you need a tent or a sleeping bag, things like that, to helping people with fentanyl testing strips and supplies that they need to be able to use more safely, and then helping people access other services in the area if they're interested in having other services for their recovery journey. So this is an organization that Measure 110 helped them grow from being an all-volunteer organization that was kind of operating remotely as they were able to now actually having a brick and mortar location that's called the Zephyr House. And it's a place where their clients can actually go to get that one-on-one peer support and case management and have a real like family environment atmosphere that they, may have never experienced before, and be able to go in and just take a rest and just really figure out what their needs are, because a lot of times you don't know what you need, and the expectation that you're just supposed to come in while you're in crisis and just say the services that you need, that's not an easy thing. So CORE is one of the many organizations that is providing these services and really smashing stigma while they do it. And so we love them and the work that they do. And they're just a great example of these services in action. Next slide. Another great example that's local to the Portland area is the Oregon Change Clinic. So this is a before and after picture of what was once a dilapidated hotel, a real like eyesore on the neighborhood. And there was a lot of, drug and crime and just other activity that happened there. And then it was actually, oh, sorry, I saw someone saying they can't hear anyone. I think that must be just maybe their audio, because you can hear me, right, Tara? Yeah, okay. So the Oregon Change Clinic, this is a great example of funds in action. So they were able to remodel this facility top to bottom and turn it from what it was into culturally specific housing for African-American individuals who are part of their 6-month intensive outpatient treatment program. And what that means is a lot of times people just assume that what's needed for someone struggling with addiction is residential treatment. That's a lot of what we're shown in popular culture and on TV. But what actually is considered evidence-based that works, yes, residential for some people, but for a lot of people, they're able to have just as much success in their recovery with outpatient treatment if they have somewhere safe and supportive to live. And so this hotel has been remodeled, refurbished to provide that setting for culturally specific housing for 6 months. And then also it's got other built-in protections in place so that as people graduate from their program and they're looking for more permanent housing, if they're not able to find it within a certain time frame, but they're doing their best and meeting the criteria of the program, they can actually stay for a bit so that there's not that gap, and so people don't fall through the cracks. And then in addition to all of the amazing services and things that this facility actually does, I mean, it's completely changed the look and feel of the neighborhood and the area for the better. Another thing that Measure 110 was able to do, these are with the early funds that came out, kind of the emergency funds before the big hundreds of millions of dollars. They were able to help Bridges to Change, which is a treatment and housing provider. They were able to help them keep their doors open in Wasco County. They had a small but strong presence there in the Dalles, and they were going to close before these funds came through. They were going to have to close their entire Wasco County office, which would have removed services from an already extremely underserved rural part of the state that really, that would have just been so bad if this had been taken away. So that emergency short-term funding helped them keep the doors open and then actually be able to expand and bring on more staff. And when I traveled there, I was able to meet with people who had been former clients of the program who were now peer mentors and going back to some of the same places where they had received services to actually meet with people and tell them, hey, I can offer you something, would you like to come to our center? And like, what do you need? How can we help? How can we support? And build those relationships because they'd been there. They had that lived experience. And Bridges to Change is funded throughout several different counties through Measure 110. And it's incredible the amount of housing that they've been able to add. Something like, I don't want to give an exact number, but I think it's like around 260 beds across the state that they've been able to add. And you wouldn't really know, they don't have like big facilities. They have recovery houses that are staffed with house managers and people in recovery. They have outpatient treatment and recovery centers where people can go. And Measure 110 funding also has this great built-in flexibility where it's able to fund a lot of the things that Medicaid doesn't cover. So in theory, if someone is engaged in services with Wasco County and they're able to get housing and kind of, the services that one would expect, they're also able to utilize Measure 110 funding to get things like bus tickets to get to treatment, or if they ride their bike to treatment and they don't have a helmet, it can pay for a helmet. I mean, stuff like that, like childcare. So they actually have that safe care for their child so they can go to treatment. So it really kind of fills in the gaps for things like that people don't often think about, those additional barriers. How are you supposed to do intensive outpatient treatment for 6 months where, the model is that it's your whole life, that's essentially your job. And then if you're not given any money for, food or to be able to go grocery shopping, that's just not really realistic. So Measure 110 also allows providers to do things like provide Winco gift cards and teach people how to do like budgeting and life skills so that they can really get the help they need when they need a lot of support, and then empower them to kind of be more on their own as they go on in their recovery journey. Next slide. Another great organization that is operating in 7 counties with burn funding is the HIV Alliance, and they have been doing what they do for over 20 years, but it's because of Measure 110 funding that they've been able to expand in ways they hadn't anticipated. So being able to add peer support specialists who operate out of Roseburg, Salem, Hillsborough to complement their other peer support services that they had, where there were these gaps in certain areas, and Measure 110 funding has helped to fill in those gaps. They have harm reduction. So again, someone can come and just get what they need to survive for that day. And then all the while, there's these amazing people working there who are able to build relationships with them, build trust, and really just let them know, hey, I care about you. I care that you're here. You matter in this world. And that might be the first time in a long time that they've had that feeling that someone really cares about who they are and that their life matters. And it's through building that trust and that care that they're able to say, okay, well, these are maybe some additional services and support that I would need. And sometimes it takes months of that engagement for someone to feel comfortable asking for that. And all the while, organizations like the HIV Alliance are working hard to keep people alive, to keep people safe. So throughout the last year, they've reversed 1,498 overdoses, and that's just what's been reported. We know with the amount of supplies and Narcan and everything that's been handed out, people don't always come back and say, hey, I gave this out and it was, reversed. Like, we know it's a lot more than that. And then an additional over 1,200 visits with peer support specialists recorded throughout the last year. So again, those are those individual touch points to find out, what is it that you need in your journey? You know, it's not one size fits all. Like, recovery is a spectrum, it's self-defined, and Measure 110 is really, from what I've seen, one of the first broad policies that kind of acknowledges that as a reality. Next. Iron Tribe Network, this is a testimonial that we actually just got from them and featured in our newsletter for November. So I'm just going to read it because it's powerful. For as long as I can remember, I have never had or experienced a sense of safety, community, or a place to call home. My past is very broken and dark. I experienced abuse and homelessness from a young age and always felt the need to block it out and numb my pain with the use of drugs. When I moved into the Iron Tribe Network burn house, I was afraid and didn't truly know what to expect. It took no time at all for me to feel wanted, accepted, and loved. The sense of community at the Iron Tribe Network is amazing, and the patience and care that is shown by the people at the Iron Tribe Network burn house is unbelievable. I learned how to budget my money, pay bills, schedule and keep appointments, and so much more. I am currently a full-time employee for Church at the Park, and I get to help people through struggles that I have lived experience with. None of this would have been possible for me if I hadn't learned the things I had learned while living at the Iron Tribe Network burn house. So that kind of says it all. They're an amazing housing provider, and they're rare in that there's not a lot of family housing. There's not a lot of permanent recovery housing in Oregon. And because of the flexibility of Measure 110 funding, they're able to create that and fill that gap. Next. Tara, would you like to pick it up from here, or you want me to keep going?
I can do it. You
Okay.
can do all the nice stuff.
Well, I'll just wrap it up by saying that with HB 4002, which Tara will talk about, that returns us back, that reverts away from the decriminalization back to criminalizing addiction, essentially, which is really sad. And we're going to talk about that. And it's wonderful that the services still remain. And so a lot of our work right now, a lot of my job is focused on really kind of visiting with these providers, talking with them, finding out the impact of their services so that we can really help people understand that no matter what happened with the decriminalization part of the law, the services part of the law still remains, and it's very effective and saving lives every day.
Great. I think you just covered this slide. Perfect.
Did I? I'm sorry.
No, don't be sorry. I think you said everything. So basically what 4002, and we spoke to some of you, I think it was in May, but I was not in a great place. After 4002 passed, basically it created this new misdemeanor, unclassified, which is 180 days in jail and up to 18 months supervised probation. You know, there was an attempt to try and create these things called deflection programs. Counties could opt in and they could apply for funding to the Criminal Justice Commission. So again, I think it's just important as we go through this movement and stay in this space. I hope people don't give up on this space, is that, you know, we so quickly went back from a Oregon Health Authority led initiative to a Criminal Justice Commission led initiative, right? And that's that difference when we go back to the guy in Portugal who said, do you want to treat somebody as a patient or a criminal? How our policy, where policy lives in our state matters. It sends a different message. And unfortunately, the message that we are back to sending is that people who are in a health crisis need to be punished. And, you know, through that, the state, you know, and the legislature was trying to find a balance between full recriminalization. They recognized, I think everybody understands that we need to be using a public health model when it comes to addiction. We are so socialized in believing that people who use drugs are bad and need to be punished or they won't get help. And we know that that's just not the case, right? What people need is dignity and love and respect. And sometimes, yes, people break the law. They commit crimes. Those are things that can be dealt with, but just possessing drugs and just being a user of drugs should not, you should not get punished for it. So that's my long soapbox of saying it's back in the Criminal Justice Commission. It's back really into a more court focus, criminal justice focus. It's still not as bad as it was before Measure 110. Before Measure 110 was a conversation, you would go into jail for a year. And that's not the case anymore. We are still, we believe that this legislative session, there could be an attempt to try and make this more punitive because the legislature really did leave deflection pretty undefined. And so different counties are doing different things. I would say Multnomah County is coming the closest to what a true deflection program is. So deflection really means that you're deflecting someone to the behavioral health system before you're booking or arresting them. Diversion is more once you're in the court system, you get diverted to the behavioral health system. For us, it's really important, what does the behavioral health system look like, just as it's important to defining the criminal system, right? Plenty of our behavioral health systems have not been serving our communities well. And so it's really important to us that we're not just kicking people over to kind of a big box mainstream treatment center that maybe doesn't have any Spanish speaking, alcohol and drug counselors, or they don't have any people from the African American community so that the person can really identify and feel and be seen and be treated with the same kind of cultural needs as others. So for us, it's really important, what are you deflecting folks to? Because health system can be just as punitive as a criminal system, right? If it's done wrong, and it can be more harmful because then people are scared of also the health systems. This is this is what the Multnomah County Deflection Program looks like. I think this is a great example of bureaucracy trying to create a person-centered care. It is a very complicated map of how somebody can get help. It's still sad that we need to make this kind of a diagram just to get somebody into to getting the help that they need, but ultimately this is their way of trying to bypass the person getting entangled through the criminal legal system. And then this is the police provider, the joint connection project that we created that I talked about at the beginning. Myself and Janie Gullickson, who runs Mental Health Addiction Association of Oregon, and this guy on the screen, Dave Bear, sat down for coffee, just saying, what do you guys need? Because this isn't working. What we're doing right now to respond to people in crisis isn't working. This happened over coffee in December of last year. And, as he kept talking, it was clear that they just don't know what to do. And outreach workers and peers do. So how do we get police connected as quickly as possible, the people that police are interacting with as quickly as possible, to these outreach workers who do know what to do with somebody and how to work with somebody and how to kind of build that relationship. So we created this pilot project that has turned into a program, and it's having its 1-year anniversary next week. And we're really hoping that this could be a guide for what deflection should look like. So basically, the police officer at the time when it wasn't criminal anymore, when it was still decriminalized, they would find somebody who was using drugs on the street. They would say, we're working with outreach workers today. Would you like some help? If the person said yes, they would call this one cell phone number. we would dispatch two outreach workers to the space. So this was just in downtown Portland at the time. They'd say, we need you to come to 4th and Cooch. The outreach workers would go out there. The police would walk away. There's no handcuffs. There's no, there's no arrest. And the outreach workers started working with the person. They connected 148 people within just 15 shifts, and 35 of those people got same-day services. It's pretty incredible when all your systems are working together for a common purpose, and when that common purpose is to heal and to connect to health and not to hide and put people away and punish. So let's see what else we got. So what's next? So as Devin talked about, we are still trying to protect the funding for Measure 110 services. We are headed into a legislative session that is with a budget shortfall. So we know that, people like to come after these funds every year. We've had to push back at least 4 significant attempts to claw these funds back. The people who use drugs and people who are struggling with addiction are a highly stigmatized population, and therefore our system does not want to invest in these folks. And so that has been abundantly clear in the way that our state has responded to this issue in the past, and how we are so woefully under-resourced still. So our big fight is in prioritizing the funding. We also recognize that the funding, we don't want the funding formula cannot change. And we also need to continue to prioritize services for culturally and linguistically specific care, so that we're still, meeting the needs of the communities who've been most harmed by the war on drugs. One of the things HJRA has been doing for the last 3 years is a pretty robust technical assistance program. We've been writing grants, working with providers for capacity building, doing whatever they need so that they can be, bless you, so they can be successful in building out their services. Just because you're a rock star at doing outreach and connect with people and know the best evidence for treatment doesn't mean necessarily that you have everything you need to run a successful organization. So we're trying to meet those needs and fill in the gaps where we can. And then continuing to work with policy makers to make sure that the deflection programs cause the least amount of harm. I don't think they're an effective tool, but if we're stuck with them, let's make sure that they are working in the best way they possibly can, similar to our police provider joint connection program. And then we always need to advocate for more funds. This is a starved system that's just finally getting a little bit of funding, even in the Measure 110 space. The first round of funding, we were able to use it for capital projects that really expanded what people could do. But now they don't have enough funds in that to be able to provide for capital funding. That is limiting a lot of folks' ability to serve more folks. As the ARPA dollars from COVID are drying up, a lot of our providers who are community-based providers, their funding streams are drying up, and we're going to do everything we can to make sure that those folks are able to find other pathways to funding. So we really can't afford to lose any funds. So that's going to be predominantly the work that we are doing. And then, as Devin said, she's continually meeting with providers to be able to tell their stories, because we know that through storytelling and we're able to meet more people so that they can understand how important these services really are. And I think that's all of our slides. So I will stop sharing.
Awesome. Thank you so much, Tara and Devin. A lot of information for sure, to um, sort of think about, right? And all the funding that is available, but as you said, it's still not enough for the resources that our communities need. So that's definitely a lot to think about. And I know we are at 7:04, so what we're going to do, so while you'll sit with all the information that both Tara and Devin share with us right now, we're going to take just a quick 5-minute break. And that way they could also get some water, stretch. Y'all can stretch, get away from your computers, do what it is that you need to do for 5 minutes, and then we'll be back to ask them questions. So think about one question that you have for both Devin and or Tara. And we also have some that we got through registration that we'll be happy to share. But please think about a question that you might have in regards to this. And we will be back at 7:10. So please come back at 7:10. Thank you, everybody. Hey, everybody. Welcome back. And once again, just want to say thank you to both Devin and Tara for sharing all of that information with us. And as a reminder, you will get the recording. So if you stepped away at any minute, you can look back at it. But one of the questions that we had, I know, I believe it was you, Tara, who mentioned was the Oversight and Accountability Council. And one of the questions that we had, do you happen to know how the role of this council has changed since HB 4002, which I know just happened this year, but just any insight that you all might be able to share about this?
So the Oversight and Accountability Council has not changed. We did some changes in the 2023 session, but that was done kind of in partnership with a lot of different organizations, including the council, to try and figure out how to get them more support. They didn't get the support they needed in the first round of grant applications, and so it was a little bit of a chaotic rollout. So nothing changed in 4002 so far. In House Bill 2513, it basically made it so that the health authority needed to be more responsive and more staffing of the council, and it created more of a accountability structure. So luckily that hasn't changed. I wouldn't be surprised if we didn't see, that was a really hard role for community members it's not a light amount of work. And these were all volunteers. So I'm hoping that the next round, I think that they're going to be asking for applications. So we'll definitely get that to Daisy and make sure that everybody here and the membership of OHEA get it. So that people, and I would encourage anybody who has experience in this space to apply. It's a really powerful space to be in. It's a hard space to be in. But ultimately, not every board or commission you sit on has real impact, and this is one that actually does.
Thank you. Thank you for sharing. And as you know, I'm asking these questions. Also, please, those folks that are here, put yours in the chat and we will get to them. One other question that came through our I know you talked, about this, but one question that really comes up a lot is what did HB 4002 do to Measure 110? And I know you already talked about it, but hoping if you can give us just a couple of sentences. Did it reverse everything or just parts of it? And I know that this is very confusing for community members because of how the media has been talking about it. Like it just threw everything out, right? It like revoked everything. And so I think that that's why this question keeps coming up whenever we have these conversations. Like what in particular did this bill change for the original Measure 110?
I feel like Devin planted that question because she and I are constantly in conversation of like, do we need to keep telling everybody that not everything was taken away with Measure 110? And yes, we do. So because it is really hard to follow, and that's part of the way the system was intended to make it so we all just kind of step away. Measure 110 was not repealed. It took the decriminalization components, and instead of it being a Class C violation, it is now an unclassified misdemeanor if you have a gram of heroin. That chart that we showed earlier of all the different limits that you could have and what crime you'd be committing for which how amounts of drugs you had in your possession, that changed from a Class C violation to a Class U misdemeanor, which is 6 months in jail. So where it was $100 fine, if you were caught with a gram of heroin in your pocket, I just keep using that because that's the top line. And kind of for me, at least, the easiest to picture, or I think it's 2 grams of cocaine. 5 fentanyl pills. So if you were caught with any of those, you used to get basically a traffic ticket. Now you could go up to jail. You could go to jail for up to 6 months. Some counties have decided to go along with deflection, which means if I'm caught with a gram of heroin in my pocket, I should be given the opportunity to go get help. The confusing pieces of that is I have to only be committing the crime of possession. Most people who are caught with drugs are because they're maybe sleeping outside, because they're committing other crimes, and therefore they're no longer they no longer qualify for deflection. So I think the easiest way to think about this, don't get caught up in the deflection conversation. That's kind of more of a nuanced, what happens to the person. Ultimately, it's a misdemeanor now. You can get up to 6 months in jail. Most counties don't have the space or the resources to put somebody in jail for 6 months for a gram of heroin, but it is now the law. And people can be harassed more. The funding formula, which is why we are fighting to, not fighting, but advocating, trying to just make it like it's not a big deal and they just need to leave everything alone. That stayed into law. The Oversight and Accountability Council is still in law. So there's still some really core critical components that are still in the law. And I think ultimately, the biggest impact we can have on our communities is giving them access to care that works for them. And that part of Measure 110 is still happening.
Thank you, Tara. Yeah, that is really helpful. A helpful summary with examples. So I know that folks will, also review the recording. So I'm glad that that question keeps coming up, I think, in different settings whenever we are talking about these topics. And I think it's really important to differentiate, right? And like the media, how it was treating it during the legislative session, I think can confuse a lot of people, including ourselves. So thank you so much for answering that question. And another question that was here and that we heard a lot during HB 4002 was how could potentially the HB 4002 affect the workload of public defenders or just the legal system overall? We know that, we heard that they're saturated. And what does this do then to our community members that might need to go through the process or the legal system overall? So just, yeah, anything that you might be able to share with us about that.
I mean, since it is a misdemeanor, it means that the caseload goes back to the public defenders who overwhelmingly said, we don't have the capacity to deal with this. So what that would look like in practice is I get caught for having a gram of heroin and maybe I committed one other small crime, so I don't qualify for deflection. So they take me to jail, they book me, I get assigned a public defender. There's no public defender available for me. They don't have any jail space. I go back out on the street and have this misdemeanor sitting over me. And there's probably no public defender that is going to be prioritized to deal with a misdemeanor. Most of them have to prioritize felonies, which is appropriate. But that means that I don't get my day in court and I don't get connected to this magical treatment that's supposed to happen with diversion and through the court system because I never got my public defender. So ultimately, it just adds to people's caseloads. Public defenders feel more and more overwhelmed with the systems, and we are not going to actually have the courts won't be able to prioritize folks, and they shouldn't, quite frankly, which is why decriminalization makes sense, with kind of these small infractions of somebody just having drugs on them. So it exacerbates a very broken system. I think what we have to keep an eye out for is that it doesn't create an argument to build new jails for counties, especially in some of our more rural counties that want more law enforcement dollars and want to build out more jails. Because we've created a new demand.
Definitely, yes. I'm gonna wait just a minute. I know there's some folks in here, but give you all a chance to ask your questions. And as I mentioned to feel free to drop them in the chat. We have some more that, came through as well, but I want to make sure that the folks here get to ask. And feel free to unmute as well. So I will give it a minute, and if there's no questions, I will definitely keep asking. Okay, I see that one came in. So from Laura, it says, thank you for sharing this. You showed the funding amounts from 21 to 23. Or those amounts cumulative from, would it be 302 plus 200? And asking, thinking about just sustainability for funding for the organizations that were funded the first round. Do those organizations have guaranteed stable funding, or do they have to reapply and maybe deal with changing funding amounts?
Yes, so the amounts are cumulative. So yes, it was 302 was the first round. Then it was 200 million. So basically 21 through 23 biennium was one round of funding. And that was a request for grant application for these behavioral health resource networks went out. People, it was a competitive process. And those were awarded to, I think, 233 organizations across the state. And then instead of through our advocacy, we asked that could they just do a budget extension for the next biennium since it had taken so long to get the first round of funding out. So that's why it's 200. It's also 200 because people were using less cannabis. And so the pot wasn't as big, no pun intended. And so 200 million really just was there for, it kind of helped keep current service levels going for those organizations. This next round of funding, the 25 to 29, is about $488 million. That's for 4 years, but it was a whole new request for grant application, and it was a whole new process that everybody had to participate in if they wanted that burn funding. That's where we come in and really do a lot of support for small community-based organizations that needed help to be competitive in that grant process. We had been asked at the beginning when we first started HJRA to help folks who had never gotten money from the state to help them learn how to do it and then how to keep it. And so that's been kind of this role that we didn't anticipate playing, but has been a big role that we've been playing in the community. And we did again this round of funding. So there is no such thing, sadly, for stable funding. We did advocate, and I would say we won. The other advocacy piece was give folks longer than 2 years of stable funding. So this next round is 4 years, which feels like a huge win for organizations. It's still, they won't find out until the spring, late spring, whether or not they are going to be awarded those funds. But once they go through all of that pain, they have 4 years of stable funding, which feels pretty great. The state can still mess with it, but I think that they'll be less likely to.
Definitely. I think you mentioned that you all help with grants as well. So I'm wondering for, the community organizations that are here and those that are going to be seeing this recording, is there any advice that you would have for organizations that are wanting to, get involved in this work and potentially apply for the funding, not this round, but in the future?
I mean, I think that, we all need to take a broader lens of health equity, and health equity is when we support providers who are of the communities that they serve. And those are really, there's so many difficult barriers. So if you're a provider of behavioral health services, like the ones that Devin and I spoke about, feel free to reach out to us, and we can try and work with you on if you're needing help kind of applying or just talking through how to build out your practice. One of the things that, we struggled, some of our providers struggled with this time around, was that just the application system is only in English and not in Spanish. And so some of our providers who, speak English, but maybe don't read English as well. It's hard when English is your first language to go through that Oregon buy system. It's almost impossible when it's not your first language. And we know the need is so great, especially in our Spanish speaking communities. So I think if you're interested in getting into that advocacy, I think that's a really important piece that we need to all be pushing forward. Is if we truly care about health equity, we need to make sure that we're building out a system that is really going to support providers who speak different languages. So that's one piece, but feel free to reach out to us if with whatever you're interested in, kind of in this space. I think, DCRIM it was not a issue of it being the wrong policy. It just came about in the wrong political time. And we'll continue to be working on ways to make sure that the impacts are least harmful for our communities.
Thank you. Yeah, that is hopeful to hear. That's a lot of what we've heard also, that this did try to get implemented during a pandemic. And so we also have to think about what that did to, the services and community members as well. And I think oftentimes we sort of brush through it and forget. And I mean, we know that COVID is still happening and it's still affecting our communities. So definitely, there's a lot of things that happened during that time and are still happening, right, as we move forward. So we need to look at, as you said, the bigger picture, and also not only one section, but more than, is it health equity related? What social determinants of health are we looking at? Is it housing? Is it other things that are affecting our communities? And I do see you both dropped your your emails at the same time. So thank you for sharing those. We'll make sure to share that out as well if you're okay with that. I know we're coming down, to the last few minutes. So I just once again want to say thank you both for being here with us today and sharing your your knowledge. I think it's important for our communities and organizations to know sort of what happened, right? What was Measure 110? How did this change HB 4002 and sort of where we're going? And I think that that was the goal today. And I hope that all of you that were able to join us today got something from here, and I'm sure you did, and a lot of resources, and you're doing amazing work in our communities, and so thank you for that as well. And I am going to add a feedback form in the chat for those who were here. See if you could just please fill it out to make sure that we just continue to make these events more accessible and hopefully better in the future. And once again, this is the first part of a series, so be in the lookout as we come up next year with the other dates and what follows. So we are working in the details of that, but Thank you so much to also the interpreters for being here, for our captioner, and all the whole OHEA team, and to all everybody really that was here today for spending the evening with us. Please be on the lookout for your email. We did send a stipend for a meal today. If again your organization or you don't want to, feel free to pay it forward. We really appreciate you all being here today, and we hope you enjoy a meal or hand it over to somebody else. And that is it for today. Thank you everybody for being here once again. Thank you to Tara and Devin for supporting the event and for all the learning that we did together today. I hope everybody has a good holiday season. You get lots of rest, lots of yummy food, and lots of warm drinks as well. Whether you like ponche or hot chocolate or whatever it is that you like. So thank you everybody for being here. We will stay connected and we will see you at our next event. Take care, everybody. Bye-bye.
Thank you.